Hello everyone, welcome to sqadia.com, and in this section, which is the fourth section of our lecture topic, genitourinary problems, we will talk about viral sexually transmitted infections. In viral sexually transmitted infections, we will talk about genital herpes, genital warts, and HIV. And we will also discuss some systemic manifestations of these viral infections. Genital herpes. There are two viruses that cause genital herpes, which is herpes simplex type 1 and herpes simplex type 2. Herpes simplex type 1 and 2 both cause genital herpes, but besides that, herpes simplex 1 is also responsible for causing a cold sores in the newborn babies or in people who have low immunity. So herpes simplex 1 is also responsible for cold sores and oral labial problems. Some symptoms of genital herpes is genital pain, dysuria, and ulcer. If you see in this diagram, these are the ulcers usually visible, and as the time goes on, early stages, the ulcers are smaller, and as they progress, the ulcers become bigger and broader. The infection can be primary infection when it is caused by herpes simplex virus type 1 and 2, and non-primary when it is infected by some other causative agents. And this is the picture in females where you can see the ulcers or lesions, and then in the males. So it affects both male and females. Herpes, genital herpes are for both sexes. Again, when the mother is infected with the herpes, and it can be transferred to the newborn baby during the delivery. The mortality rate is very high, and there can be a lot of neurological complications in the newborn baby with very high morbidity rate or very bad condition. So the treatment of herpes include acyclovir. Acyclovir is antiviral drug. The important feature of this herpes infection is once herpes virus enters the body, it can stay in the body in the dormant form, and sometimes it can reactivate it, and under certain condition reactivation can occur when patient immune system is low, or when they are sick, or when they are taking steroid medications. They can be again attacked by or there can be again an outbreak of the herpes infection. So herpes virus enters the body here. It can lie dormant in the nerves. It lies in the nerves of the body, different nerves, and sometimes it can be reactivated, causing the outbreak. This is how it can be reactivated, because it stays dormant in the nerves. Shingles is also an example of herpes infection that can occur due to reactivation of the dormant herpes virus. Genital warts. Genital wart is another form of infection caused by the virus, and it is caused by the papilloma virus, HPV, human papilloma virus. It's a benign epithelial tumor caused by HPV, human papilloma virus infection. And human papilloma virus infection is also cause of the cervical cancer. Cervical cancers are very common in young age, and in females who have multiple sex partners, cervical infections are cancers are common, and those are caused by the HPV or human papilloma virus. There are different strains of human papilloma virus. It can be 16 and 18 is very common, and 6 and 11 are also common. So HPV vaccinations are available, which is bivalent or quadrivalent. Bivalent means two. Bivalent are effective against 16 and 18 strain, and quadrivalent are effective against all four, 6, 11, 16 and 18. Other treatment include is the ablative therapy, in which the liquid nitrogen is applied to this wart, and that can burn it or remove it. Surgically, these can be removed also, and patient can apply the ointments topically, means on the skin, on the area in which usually podophylotoxin is the use. So this is the picture showing the genital wart. HIV is a human immunodeficiency virus. It's the causative agent of AIDS, which is autoimmune deficiency syndrome. And HIV infection, initially patient is asymptomatic for a very, very long time, and in that time usually the infection can be transferable to the person. And how it acts is it causes decrease in the immunity. It attacks CD4 on the CD4 cells present on the T cells, and it affects cell-mediated immunity or affects cellular immunity. And once the immunity becomes very low, then it's autoimmune. Autoimmune means the antibodies start, immune system becomes so weak that they start antibodies affecting the or eating their own body cells or body tissues, and causes different system or involvement slowly because of the decrease in the immune system. Some common diseases that are common in AIDS is cervical cancer, cervical intraepithelial neoplasia, high-grade squamous intraepithelial lesions, and vaginal intraepithelial neoplasia is common. So it's also viral disease, and it can affect the immune system, and that effect on the immune system leads to autoimmune disorder, in which there is destruction of the patient's own immune system and cause weakening of the immune system. If you see on these statistics, it's common, very common in sub-Sahara Africa, in which there are about 1.4 million cases of the AIDS, and also here it's common in the Asia and other Pacific, where are about 340,000 cases. So AIDS is coming very, very common worldwide. Some gynecological complications of HIV are most commonly, these are complications are after infection with human papilloma virus 16 or 18 strain. And contraception and preconception management of patients with AIDS. It's very important that whoever with patient, any person with AIDS or women with AIDS, if they want to become pregnant, it's important that their condition should be well stable, and their AIDS is under well control, so they can give rise to birth to healthy normal baby. So antiretroviral drugs are used for AIDS, And antiretroviral drugs have interaction with hormonal contraceptives. So anyone who is using hormonal contraceptives for contraception and at the same time using antiretroviral drugs should be alert, because it can decrease the effectiveness of the contraceptive drugs, and person or female can conceive while on these drugs and antiretroviral drugs. HIV control is important. Screening and treating any coexisting STIs. If there are any STIs like gonorrhea, chlamydia, they should be tested and treated. And fertility assessment is also very important, whether the person or female can become pregnant or not, what's the fertility condition of the patient. So that was all about the viral STIs, which was herpes, warts, and HIV. Thank you for watching sqadia.com.